Good evening, we're from Ukraine. I'm Alexey Kalmykov, medical doctor, scientist, lecturer, and entrepreneur. Today I'm going to represent you some cases from our supervision, troubleshooting, medical guiding, supervision, and follow-up in the United Medical Volunteer Center as a department of International Charity Foundation and Association of Humanitarian Centers. Today is 19th of May 2022, and we have such admissions as or applications as an adult woman with severe pains in her back. We requested the documentation, perform the analysis of the history of the patient, both life history and anamnesis morbi. We advised to perform the magnetic resonance imaging, and on the background, on the base of the results of it, we have decided that probably they will be mostly a problem dedicated to radicular syndrome on the background of osteochondrosis, predominantly in lumbar and thoracolumbar region. We started acute blockade by anesthetics, and in combination with non-steroidal anti-inflammatory drugs, and probably in few days we expect improvements of her condition. Of course, she undergoes our supervision and follow-up. Next admission, an adult person, woman aged 38, and it's similar with there are complaints on heart pains in lumbar region, in the region of vertebra. We also have administered MRI, and on the base of it also arranged proper treatment with blockade of the pain with anesthetics and further injections of non-steroid anti-inflammatory drugs, and general follow-up we'll see later. Then an admission of adult person aged 44 with thyrotoxicosis, already diagnosed for 2 years. She has already treatment with Espacarb 5 milligrams, and as a result of this and periodical medical checkup, due to normalization of the condition, her drugs were stopped, and at the moment of admission she complains on hard beating, irritability, general weakness, and such a feeling of dyspnea. Basing on the examination of family doctor, physician, we have administered the laboratory test with evaluation of hormones, of thyroid gland, of a part of course, basic laboratory studies like complete blood counts and biochemical blood test, including glucose, and also our clinical psychologist has examined her with appropriate administration of antidepressants, and we continue follow-up of this woman. Today also there was admission of let me see, an adult with a request of consultation of dermatologist and allergologist. At that place and that situation, there was a case mostly related to allergic reaction with a need of differential diagnosis with mycosis. He was directed for offline laboratory test and offline examination or consultation of dermatologist, and basic treatment as preventive with reasonable diet, hypoallergenic, with preventive desensibilization therapy, and we expect improvement. It was stated at the end of this day that he feels this improvement. Anyway, we'll continue and fix this problem. There was one more similar appointment of young person, a young girl aged 18 with a complaint on so-called burning, tickling pains in the region of distal parts of distal phalanx of hands. In this case, we have supposed chemical burns because she has been cleaning up her flat for one hand. For other, we observed some excitement, unusual excitement, and our psychologists have already tested this person, and local treatment with good result and improvement of condition has been performed together with general psychological approaches. So we'll follow up here, we'll continue to follow up here. One more admission was regarding the question how to improve the growth of hair. She has been already using a complex vitamin pharmacological preparation, and omega-3 drugs as well. In this case, we have discussed with this woman her regimen, her nutrition, made suggestions, of course, and our family doctor, together with trachologist, continue to follow up her. Next, a child with fever and pain in abdomen, mostly left side, in the region of pubis, without no more with no more symptoms. We ask her mom, right, to be online and performed online video consultation. We taught her how to palpate the abdomen and have revealed no specific symptoms. A general approach with normalization of psychological condition was advised at the moment. So the admission was at 3 p.m. Now we have 20 p.m. This child feels good, no pains, no other symptoms, so we continue to follow up. Many more admissions took place today. Probably we'll discuss them some other time. Thank you. See you later. Good luck and be healthy.